The discovery of HIV antiretroviral therapy, or HAART, marked a turning point in the fight against HIV/AIDS. HAART is a combination of medications that prevents the HIV virus from replicating in the body. This treatment has been incredibly effective in prolonging the lives of people living with HIV, allowing them to lead healthy and productive lives. Before HAART, an HIV diagnosis was often seen as a death sentence, and people with HIV faced a bleak future with limited options. HAART changed everything. When taken consistently and correctly, HAART reduces the amount of HIV in the bloodstream to undetectable levels. This viral suppression is crucial in preventing the sexual transmission of HIV. By significantly reducing the risk of transmission, HAART is a powerful tool for public health. It has the potential to break the chain of HIV transmission and move us closer to an AIDS-free generation.
In 2014, UNAIDS set ambitious targets to end the AIDS epidemic by 2030. These targets, known as the 90-90-90 targets, aim to have 90% of all people living with HIV know their status, 90% of those diagnosed with HIV receiving sustained antiretroviral therapy, and 90% of those receiving HAART achieving viral suppression. These targets have since been updated to 100-100-100 to reflect the goal of leaving no one behind. While significant progress has been made towards these targets, challenges remain. Many people living with HIV are still unaware of their status. Access to testing and treatment services remains limited in certain areas, particularly in low- and middle-income countries.
AIDS. 2024 is being organized by International AIDS Society, IAS, along with the government of Germany and partners. The global HIV epidemic affects different regions and populations in unique ways. Germany and India serve as contrasting examples of the challenges and successes in the fight against HIV. Germany, a high-income country, has a relatively low HIV prevalence rate. Germany's success can be attributed to a comprehensive approach that includes strong public health infrastructure, accessible testing and treatment services, and effective prevention programs. However, challenges remain in reaching certain key populations, such as men who have sex with men and migrants.
In contrast, India, a lower middle-income country, has a larger HIV epidemic. India has made significant strides in recent years in expanding access to HAART and reducing new HIV infections. The country's success can be attributed to strong government leadership, a robust network of community-based organizations, and targeted interventions for key populations. However, challenges remain in addressing stigma and discrimination, improving access to services in rural areas, and reaching specific populations such as transgender people and people who inject drugs.
Reaching the most vulnerable key populations and integrated services. Addressing the HIV epidemic requires a focus on key populations. New HIV infections globally have declined over the last 10 years by 38%, which is not enough, but at least it is headed in the right direction. These populations include transgender and men who have sex with men, transgender people, people who inject drugs, sex workers, and prisoners. These populations often face a higher risk of HIV infection due to a stigma, discrimination, criminalization, and lack of access to healthcare services. Integration of HIV services with other health services, such as tuberculosis care, is also essential. TB is a leading cause of death among people living with HIV. Integrating these services can improve treatment outcomes, reduce costs, and increase access to care.
Investing in the future, engaging young people in the fight against HIV. Young people, particularly adolescent girls and young women, are disproportionately affected by the HIV epidemic. In sub-Saharan Africa, adolescent girls and young women account for a significant proportion of new HIV infections. Engaging young people in the HIV response is crucial for achieving an AIDS-free generation. This includes providing comprehensive sexuality education, increasing access to youth-friendly healthcare services, and addressing the social and economic factors.
Renewed investment in HIV prevention, particularly for young people and key populations, is urgently needed. This includes funding for research and development of new prevention tools, such as vaccines.